So my goal for any client that I'm working with, that when asked, they know exactly what they're working on, specifically for treatment goals. All right, I'm Ebony Hicks, behavioral health therapist with the West Baltimore team for Healthcare for the Homeless. It keeps me on task. What are we focused on as far as the problem areas, and really guides the client to know that everything we're doing is intentional. So first off, anybody that has any kind of depression diagnosis, I'll ask them if they're okay with being in it, then I'll enroll them there. So we go through each session, kind of checking in. Let's remind you about what your treatment goals are, and let's have an honest assessment of how they're progressing or not progressing, and if we have to kind of go back. It's just very good to have clients be guided, because it can, especially in this session, can go really left or far off, and okay, let's really just make sure we're here with a purpose and actually focus on that purpose. So first, I'm big on baselines, like where are you now? So a very realistic manner of where can you see yourself in the next 6 months. So that 6 month part, we can say, oh yeah, I'd like to do this in a year or so, but for 6 months, let's really try to be very realistic about where can you go in that. So like an example of one would be like I said, a client has no coping skills. So now let's do 3 things we know you can go to. Like you have like almost like your tool bag that you can implement within the 6 month period to try to deal with like your anxiety, your depression, whatever you're dealing with outside of this office. Because with SMART goals, they have to be measurable. Yeah. And so that actually kind of helps, as much as it kind of irritates me too, because it's good with like helping the clients like make it concrete. Like, so if, I'll just give an example, even with like smoking. If you smoke 10 cigarettes from the beginning, and we want to be concrete and say, well, okay, you smoke 10 cigarettes a day. It won't be realistic to say, let's go from 10 to 0 in 6 months. Maybe we'll say you'll cut that by half. Again, visit like where the pitfalls, where is this not being realistic with, or where the bumps coming in. And I really think it's so important every session to look at it, because one, I noticed it really encourages clients to feel like, oh, I am making progress. So having it every session to kind of know you have to check off if it's progressing, regressing, or no change, that's super helpful. So I like to introduce the whole process for clients, especially anybody new to therapy, that from the beginning we're going to do all these assessments, and then by usually about the 3rd meeting, we're going to have to make your treatment plan. So in their mind, they already know from our very first interaction, goals are where we're going to eventually go with. But it's going to be your goal, and I'm just kind of like helping you get to it. Because I think that's what differentiates a counselor versus like somebody from the house, like a friend or a family member. That, yeah, you can come here to safe space to vent and problem solve, but we have to be focused on where we're trying to go with your mental wellness overall. So the treatment plan really helps with that. So again, with going through it every session, that you're not surprised with the way they're progressing. So that's a good concrete way to say, hey, remember we made these goals? You've knocked all these goals out. You're at a good place. And then when we're trying to update, I've seen clients struggle with like, oh, I can't even think of another goal. So to me, that points to it's probably time now to work towards ending it. So I think that's a nice, safe way to kind of point out to clients that you made these wonderful progresses. Like, it's okay. We can part and revisit if we need to. I don't plan on going anywhere. So I'm not just kicking you out of the therapeutic process. You've accomplished these wonderful goals. You've done it. It's just to get in the habit of every session clicking it. It just becomes like muscle memory. It becomes like the back of your hand. You just kind of do it. You click on it and you update it. It's become so second nature to me. I really don't even think about it.
Like any other part of the visit then?
Yes, exactly.